केमो, नाम तो सुना ही होगा. आर यू अफ्रेड ऑफ केमोज? हैव यू हर्ड अबाउट केमोथेरापी? आजकल का ज़माने पे अभी तक तो सबके घर में कोई ना कोई, in every family is suffering from or was suffering from cancer and getting chemotherapy. So all of us are tremendously afraid of chemotherapy. Whenever we hear the word chemotherapy, a cold wave runs through our spine. सच में क्या इतना डरावना है chemotherapy? Let's find out. Hello, I am Dr. Arghya Basu, gastro and cancer surgeon, welcoming you all to another interesting episode of our Healthy Chit Chat in your own YouTube channel. Welcome. Hello friends, this is Dr. Arghya Basu, gastro and cancer surgeon, welcoming you all to a very interesting episode of your own YouTube channel Arghya, where we discuss various gastro, cancer and surgery related problems and try to help our patients and viewers with accurate and state-of-the-art medical guidance even at personal level. Now let's come to history first. What is chemotherapy? Chemotherapy conventionally doesn't mean the medicines used for cancer, but actually chemotherapy means any sort of chemicals that can be introduced in human body for any kind of treatment. Like conventionally antibiotics, simple antibiotics are also one kind of chemotherapy. Traditionally we have confined this term of chemotherapy in case of cancers only. So what is a chemotherapy? Definitely it's a poison, it's a toxin. A chemotherapy is a poison that is going to kill cancer cells as well as it is going to harm your normal body cells in either or some other way. You have to suffer through it. All of us knows no pain, no gain. So if you have to win over the pain of cancer, you have to tolerate chemotherapy. There is no alternative to it. To treat cancer in this battle against cancer, we have three main weapons with us. One is surgery, the second is chemotherapy, and the third is radiation therapy. Surgery has immediate effects, but it doesn't have long-term effect or systemic effects over our entire body. But chemotherapy is such a chemical which is introduced in our body through some of blood vessels like veins, which runs in our veins, which reaches every organ in our body including the organ harboring the cancer and then kills the cancer. It doesn't only kills the cancer where the maximum lump, maximum cancer is residing, but it is also killing the floating or the swimming cancer cells. The cancer cells, what is the cancer? It is a tumor that spreads all over the body, that is not localized to its original location, but it spreads. So how does the cancer spread? Usually carcinoma or cancer spreads by lymphatics or lymph nodes, whereas sarcomas spread by blood. So to treat cancer, we have to stop or limit the spread of these cancerous cells through lymphatics on bloods, through lymphatics or blood vessels. So how we can do that? Naturally we have to introduce some drug through the blood or lymphatics, which will run to the cells even at the distant part of our body. It will deliver the drug to the distant cells of our body, and in some cases it will selectively find the cancer cells and it will kill those cancer cells. Now naturally the chemotherapy drugs which are not that selective, it will kill the cancer cells and at the same time it will do some harmful effects on our normal body cells. So there will be side effects of chemotherapy. How can we reduce that side effect? We are going to deal with these tidbits in our next section. Please listen to the video till the very end so that you don't miss any vital point, and at last where I will share with you the links how you can get in touch with me and get personalized advice and guidance. Now we will go to the treatment and further discussions part, but before that, if you are enjoying the show and अगर आपको कोई benefit मिल रहा है तो please ये चैनल को सब्सक्राइब कर लीजिए and बेल आइकॉन को प्रेस कर दीजिए so that you will get notification every time we post a video, and this will give me and my team a huge inspiration for our hard work. Thank you. Now, without any further delay, let's dive deep into the problem and how we are going to tackle it. There are a few factors by which we can improve our chemotherapy infusion and reduce the side effects of chemotherapy. Number one is quality of chemotherapy. How we are going to decide the quality of chemotherapy? Suppose you are having fever. What you are going to take? You are going to take simple paracetamol. Now, when you go to market in any chemist shop, you will get paracetamol starting from 50 paise to approximately 3 rupees per tablet. Now, definitely I won't tell you कि the 4 रुपया वाला पैरासीटामोल सबसे बढ़िया है और 98 वाला पैरासीटामोल बिल्कुल बेकार है. Now, it's common sense. Definitely the drug takes a certain amount to be prepared in a good company, a company which doesn't compromise with the quality, a company which tries to deliver the best quality of drug in best amount to the ailing patients to give you quick relief. At that point of time when you are having that fever, there is only one thought in your mind: how soon am I going to get relief from this fever? So, here you won't compromise with the quality or the brand. Definitely जो थोड़ा अच्छे वाला पैरासीटामोल होता है, it works better than सबसे सस्ता वाला पैरासीटामोल. So, don't compromise with brand, don't compromise with company, don't just run for बस केमोथेरेपी चल रहा है. Always look for the brands. कौन सा ब्रांड का केमोथेरेपी आपको मिल रहा है, which company is supplying that chemotherapy to you and what the patient is actually getting. If you choose a inferior brand or inferior company, in that case definitely that chemotherapy will have more side effects and less amount of actual effect on the patient's system. On the other hand, if you choose a reputed brand, a time tested brand, definitely that chemotherapy might be a little bit costlier, but that will give your patient optimum relief, immediate relief and long lasting relief. So, don't compromise with brands. That is the first and foremost thing. The second point in our discussion is how to infuse or transfuse a chemotherapy. Definitely a chemotherapy is given by veins. That can be given by normal venous channels that we can see in each and every patient who is getting admitted to a hospital. On the other hand, we can transfuse chemotherapy through chemo ports also. Chemo port is a novel device which is in right now because it reduces the suffering of a cancer patient out of chemotherapy to a tremendous amount. How does it do that? It is just a tank with a catheter attached to its end. The tank is implanted just below the clavicle or collarbone under the skin so that you cannot feel that port from outside, but your functions are over. The patient can get blood transfusion, platelet transfusion, plasma transfusion, chemotherapy, IV fluids, IV antibiotics, everything through that chemo port only without searching for vein here and there all over his or her body. On the other hand, blood samples for blood testings can also be collected easily by a trained individual through that chemo port. If your patient is having chemo port, all problems of chemo transfusion, the technical problems are over, because in most of the centers the chemotherapy is infused by sisters or resident doctors who do not have that much expertise in making channels in difficult thrombosed veins. Veins are patent at the first hand, but after getting 2, 3, 4 cycles of chemotherapy, chemotherapy is vasculotoxic, it destroys the inner wall of the blood vessels, and so the veins become cord like, they look like dried up cords. You cannot penetrate or prick that vein, no blood will come, no saline or chemotherapy will go into that vein. But in some faulty hands, sometimes chemotherapy can get infused through those fibrosed veins, which can be disastrous. That will lead to blisters, that will lead to cellulitis, that will lead to abscess formation in a patient's hand. I have seen patients who had to undergo amputation even due to faulty chemotherapy transfusion technique. So, always and always try to infuse chemotherapy with a chemo port. The next important thing is timing of chemotherapy. See, chemotherapies are toxins. All over the world, oncology runs on trials. There are numerous trials performed all over the world on how much time should be taken to infuse a certain quantity of certain amount of drug. Like मुझे अगर 1 ग्राम पैरासीटामोल किसी का शरीर में इन्फ्यूज़ करना है, घुसाना है, तो हाउ मच मिनिमम टाइम शुड आई टेक टू इन्फ्यूज़ दैट अमाउंट ऑफ पैरासीटामोल. That has been proven by different trials, and you will get different companies who prescribe different time schedules for their specific products. Similarly, all chemotherapy companies also, after performing prolonged trials, usually denote specific timelines for running a chemotherapy. Now see, in low volume centers or where we have enough adequate manpower to look after the patient, we always try to maintain those time protocols so that the patient is getting that toxin over that certain period of time. But in some small centers where adequately trained manpower is not available, sometimes I have seen patients get a chemotherapy transfused within 1 hour, which was supposed to get transfused in 6 hours. Now that is disastrous, because that toxin which was supposed to go inside your body over 6 hours slowly, now it is going inside your body within 60 minutes, and you can assume, you can think of how much damage it is causing to your vessels, to your blood components like red blood cells, white blood cells, like your all tissues, your brain, your heart, so on and so forth. So it can be disastrous. So always get the chemotherapy done under the direct supervision of a trained doctor who is trained in chemotherapy infusion. Last but not the least, when a patient is getting chemotherapy, he or she should receive adequate amount of supplementary medicines. Supplementary medicines include some medicines which will protect human body from possible side effects of chemotherapy. What are these medicines? The commonest side effect of any chemotherapy is bone marrow suppression. So our bone marrow gets suppressed. What does it cause? It will reduce the number of white blood cells, red blood cells, platelets, all blood components immediately, because basically blood components gets their origin from our bone marrow. If the bone marrow gets suppressed due to direct effect of chemotherapy, it is going to be disastrous for the entire body. So we often supplement the patients with colony stimulating factors or CSF or GM-CSF, granulocyte macrophage colony stimulating factors. These factors are available in pre-filled syringes which are given by subcutaneous route in the patient's perinaval area on daily basis for 1, 2 or 3 days according to the treating oncologist's personal choice. Some chemotherapy companies give direct instructions regarding how many filgrastim, how many supportive colony stimulating factor injections does the patient need, and some don't. They leave it on the prescribing physician. But whatever you might be, your oncologist should be aware of that and should not hesitate to give you support with colony stimulating factors. Again, there are some nutraceuticals. Nutraceuticals are macrominerals or microminerals along with vitamins which give the patient's body support for tolerating the chemotherapy. These chemotherapy supporting drugs, I personally start them beforehand. Whenever I am contemplating to start chemotherapy in a patient, I always take 10 to 15 days of time beforehand to prepare the patient's body so that he or she can tolerate the chemotherapy. I will send the patient to a proper dietitian or a nutritionist who will put the patient on proper balanced diet. I will send the patient to a psychiatrist who will psychologically counsel the patient regarding the journey of cancer. I will send the patient to other associated health workers to prepare the patient for chemotherapy. Chemotherapy is a journey, and if you are going to a journey, to a long term journey without proper preparations, you are just going to suffer. That is the thing which happens most commonly in patients of developing countries like ours. We go into this journey of chemotherapy without any preparation, without any supply, and without proper supervisions. This combination is disastrous. Always prepare yourself before jumping into a journey of chemotherapy. Take proper opinion from proper trained doctors, sisters, associated healthcare workers. Choose proper brands. Get chemotherapy infusion by chemoport preferably under the supervision of a properly trained doctor or properly trained cancer care sister. And always remember what people always ask me, sir, chul ki pode jabe? Yes, hair fall is a known side effect of almost all chemotherapies, but remember, this is not permanent. This is purely temporary. Till the chemo is running in your veins, the first effect that one can see is bone marrow suppression and hair fall. But as soon as the effect of chemotherapy is over from your system, your hair cells will regrow again. You are not going to be bald for the rest of your life. You will be having your normal kind of hair within 6 months of ending that chemotherapy. और अगर जिंदगी ही नहीं रहा तो बाल को लेके आप क्या करेंगे? पहले जिंदगी बचाना है ना. Then comes your hair and your cosmesis, your appearance, everything. Always bear this thing in your mind that we are treating cancer. We are not treating benign diseases like gallbladder, appendix or hernia. We are treating cancer. So our first goal is to save the life. Whenever we have already saved the life, then we will be concentrating on secondary aspects like hair, like appearance, everything. And we have advanced solutions for all of these problems. So before starting your journey of chemotherapy, take proper opinions, don't compromise on brands, and enjoy your journey of chemotherapy. Don't be afraid. You can get connected with me and follow my posts, videos and blogs in my social handles given in the description box just below. If you want a personal consultation with me, please WhatsApp or call in the following numbers. My team members will personally get in touch with you as soon as possible.